What do you think, Mr.? Can adopting digital tools help Indonesia's healthcare industries become as competitive as other countries, for instance, Malaysia and Singapore?
The digitalization, and I applaud the initiative that the government has in Sarjito, right? We actually also help Sarjito on digitalization as we speak, right? So there are multiple aspects of sustainable health. One is, of course, education of people. With COVID, you've seen patients becoming more and more aware of health. So not only they hear from doctors, but now they check. Of course, with that, you can have sustainable health. Second is training of the medical practitioners. So deploying training across the country and helping digital practitioners to be more aware of new treatments and new ways of medicine. And then after also is efficiency. So, reducing the cost by providing telemedicine, by providing a lot of things directly, even to more remote areas of the country. It's quite easy to do in major cities, but Indonesia is very big, very complex. I've traveled to many of these places. It's not easy to get there, especially with the connectivity you have.
Yeah, and what is digital technologies APL currently using to improve healthcare services for the community?
So I think there are a few aspects. So one is making sure that we have the ability to reach through digital the doctors. So one is education, right? So providing digital technology and providing the healthcare practitioner access to the digital technology. The second one is simply ordering platforms. And when you have ability to order online, when you're able to see exactly what's happening on the things that you need, typically that means you're going to help improve your connectivity. And then, of course, again, right, training. We can, for example, we deployed training platform for pharmacists online, which provides, again, right, a rapid expansion of treatments and making sure that everyone knows what's the latest available. So I think aside of this, of course, the efficiencies in the system, right? Because if you see efficiency in your supply chain, which, Indonesia is very large, sometimes it takes very long to go to remote areas, and this tie up cash, and with interest rates being high, of course, you can reduce the cash tied up.
Yeah. If we talk about the technology that change rapidly, huge, we cannot avoid to talk that it create a cyber crime. How can you ensure the safety, the security of the patient data?
Well, before you go to patient data, I just want to also highlight many patients get their information from reliable sources, but there are very unreliable information out there on social media. So, combating false information that some people spread is very, very important. The second part, of course, is you need to secure data. So actually, in APL, we spend a very big amount of money to make sure that there is no one who can, number one, access our data, second, tamper with our data, disrupt the supply chain, and potentially get people out of medicine. Because you have to know, when there were cyber attack, I think it was in 21, some companies were out of email for 3 weeks. 3 weeks in this modern age, right? So we don't, we have a very good systems in place, but we are working every day to protect patient data, of course, but also security and resilience of the supply chain, which is also a big topic of the Minister of Health, right? Resilience of supply chain.
And as a digital technology grows in healthcare, how does APL address resistance from conventional healthcare workers who may be hesitant, reluctant to all the new tools that you may provide?
So a few things, right? So we use things like machine learning. We use things like adaptive machine learning, deep learning soon. So it's like there are many tools available, from AI, so digital or AI, to help us become better. And I think the one message I could have with people is, don't be afraid
to try.
Just adopt, but also be aware of all the potential downfalls of these tools, right? So, social media is great, right? But there is, with freedom of social media, you have a lot of things that are on social media that actually may be not so reliable in terms of true information. And it's okay for social media, but when you want really to check information, you should go back to, media that you can trust and check the information through what I would say sources that you know to be more relevant or more, I don't know the English term, but anyway, safer environments. I think the other part is some people think that digital or AI will replace human beings.
Yeah.
Some jobs, for sure.
Yes.
We cannot, it's like we used to have
avoid that.
Yeah, exactly. You used to have people lighting the street lamps, right? It's over because now it's all automatic, right? And it's okay. I think what we need to see is this is going to create also a lot of new jobs and improve our lives, right? If you can have some things that are automated and treatments that are getting better because of AI helping humans, I don't believe AI will replace, but AI will be like a new tool. Like we have computers, and computers are helping our lives. They don't change.
Okay. So what kind of opportunity that AI could create in terms of healthcare industry?
Oh, the list is too long to nominate everything, but I think there are lots of things.
Mention just 3 of them.
So for us, in particular, relevant to Indonesia, I think education to people, and nowadays you can just look any AI tools and just ask, you describe your symptoms, and you will have an idea of what's going on for yourself.
Yeah.
And this is already, wow, a great thing. Of course, you go and see the doctor. The doctor will be able to tell you much more, but at least you have some level of confidence. If I look a little bit deeper, you have many AI tools in diagnostics, helping analyze image, helping analyze some information. Today, you can detect some diseases just by taking a picture of your eye and checking your, they will be able to tell you if you have certain disease or so very helpful. But the last one I would say is organizing supply chains. So using AI in supply chain and making sure that, again, right, in a country like Indonesia where it's very difficult, especially with the ambition of government, right, going everywhere, making sure everyone has access is difficult. And this is something we can work with.
Now, how is APL digital innovation spreading all over Indonesia? How APL could reach rural areas?
I think one of the difficulty we have, at least I've been here more than 5 years, at the beginning is we were able to do pilots in one area of the country, but deploying in the rest of the country used to take forever. And one of the things I realized is everything can be actually fast in Indonesia. As long as you have a clear purpose, people can go really fast. And I convinced some of my regional team, let's try to go fast. We had the fastest digital, we just renewed our, updated our digital tool. We had the fastest deployment of all countries of Zuellig Pharma. And that includes Taiwan, Hong Kong, Singapore, Korea. We were the fastest. Why? Because the team was aligned, we knew what we had to do, we aligned everybody, prepared with digital, and then bang, we went. And the team was all together going to implement something new. This is possible in Indonesia. Many people say, oh, it will take time. And no, it doesn't have to. And patients who are in remote areas, they don't want to wait. They want to have access to things quickly. So I think this is a mindset change that some people need to have. It's like, oh, it will take time. No, we're in a hurry. Look at the adoption of Indonesia for universal healthcare. It's one of the fastest adoption of universal healthcare seen on earth, right? Is the speed of the country to adopt. Of course, there are still many things to do, but it's one of the fastest. So in digital, it's the same. You have to know, of course, you access maybe in the remote areas at 2G, We access in 4G, maybe 5G in Jakarta, but and some of the major cities. But of course, you have to plan with this in mind. But with good planning, Indonesia is able to execute at very high speed.